Hi everyone, my name is Love. I'll be presenting my grand rounds case on a patient that I saw during my pediatrics rotation. So I had an 8-month-old male with a history of congenital adrenal hyperplasia present to the office brought by his mother for a sick visit. The mother reports that he had a low-grade fever of 100.1 degrees Fahrenheit since yesterday evening. She gave him 2.5 milliliters of the oral suspension Tylenol with relief, and the patient was able to fall asleep. However, the patient woke up in the middle of the night with rhinorrhea, nasal congestion, and was crying. She did not take his temperature, however, the patient felt hot to touch, so she gave him another dose of the Tylenol. So the mother states that the patient is up to date on all immunizations and reports that the father was sick at home last week. He did perform 2 at-home COVID tests, which were both negative. She states that the father was using a mask at home, but wanted to be safe given his history of the congenital adrenal hyperplasia, so she brought him in for further evaluation. She states that the patient has otherwise been healthy, but does note that he has had some intermittent drooling and disrupted sleep over the last few days. So on review of symptoms, the mother reports fevers, clear rhinorrhea, nasal congestion, occasional drooling, decreased sleep, increased fussiness and irritability, and sick contacts. She otherwise denies poor feeding, loss of appetite, ear tugging, earache, eye discharge, excess tearing, cough, wheezing, shortness of breath, nausea, vomiting, diarrhea, constipation, abdominal pain, or rashes. So typically, my preceptor doesn't recommend parents giving their kids Tylenol for low-grade fevers unless it exceeds 100.4 degrees Fahrenheit. Given this patient's history, there is a catch to that. So the patient takes hydrocortisone 0.16 milligrams 3 times a day and a 1 gram salt tablet mixed with breast milk for maintenance therapy of his congenital adrenal hyperplasia. So when they're in the setting of mild illnesses and decreased PO intake, this can trigger an adrenal crisis, and in order to prevent an adrenal crisis, patients with congenital adrenal hyperplasia require stress doses. So if the patient's temperature exceeded 100.4 degrees Fahrenheit, the mother would have to double the dose of his hydrocortisone. So what exactly is an adrenal crisis? Because the adrenal gland is insufficient, there are signs of salt loss, which includes vomiting and diarrhea, resulting in dehydration, severe abdominal pain, fever of unknown etiology, poor feeding, which leads to weight loss and failure to thrive. There are also electrolyte abnormalities in adrenal crisis. This includes hypoglycemia, hyponatremia, hyperkalemia, metabolic acidosis, and shock. So back to the case. On physical exam, the patient was afebrile with a temperature of 98.6 degrees Fahrenheit. He appeared fatigued but was otherwise alert, active, and no acute distress, well-developed, well-nourished, and well-hydrated. On HENT exam, there was slight drooling with eruption of tooth number 10 noted, but no other findings. On GU exam, there was mild brown hyperpigmentation of the scrotal region, and this is because in congenital adrenal hyperplasia, there is increased melanio stimulating hormone. All other physical exam was within normal limits. With this patient's history and exam findings, my top differential diagnoses include teething syndrome, acute nasopharyngitis, which is also known as a common cold, and otitis media, but given his history and exposures, you should also consider seasonal rhinitis, viral upper respiratory tract infection, and bacterial sinusitis. So with the patient's symptoms and exam findings, my preceptor and I concluded that the patient had teething syndrome. Other symptoms of teething include diarrhea, which is secondary to increased saliva production that the baby usually swallows. Additional symptoms include rash around the mouth area, itching at the tooth where it's erupting, trying to bite and suck on everything, low appetite, like loss of interest on solid foods, watery eyes, and lacrimation. So we basically educated the mother on cleaning the tooth with fluoride toothpaste, to schedule the first dental visit within 6 months, and advised on choking hazards such as teething necklaces, chewing toys with multiple pieces. Management of teething syndrome is supportive care. We advise the mother to give the patient chilled teething rings, like in the picture on the slide over here, clean, cool cloths, fluids, and breasts. And like I said before, we usually don't advise parents to give patients Tylenol for low-grade fevers unless 100.4 degrees or higher, but given that the patient has congenital adrenal hyperplasia, he does have a lower threshold for intervention due to the risk of adrenal crisis. So we said it was okay to give the Tylenol for his increased temperature and for pain control. And this was confirmed by a previous consultation that my preceptor had with the patient's pediatric endocrinologist. And we also counseled the mother on the max daily dose of Tylenol. We also counseled the mother and other parents with patients experiencing teething syndrome to avoid topical analgesics, topical gels, and homeopathic remedies to alleviate pain. Studies have shown no clinical benefit. Use of topical gels and analgesics can result in the patient swallowing them, which can weaken the lower esophageal sphincter and result in GERD and reflux symptoms. The studies have also shown anticholinergic toxicity with use of viscous lidocaine, and after a single spray of benzocaine, studies have also shown signs of methemoglobinemia in patients. This includes cyanosis, hypoxia, seizures, and coma. So signs and symptoms that warrant turn, we counseled the mother on fever refractory to Tylenol for more than 24 hours, worsening of the patient's condition and persistence of symptoms for more than 24 hours despite using supportive measures such as the chilled teething rings. And for this patient's case, signs of adrenal crisis, such as persistent vomiting, diarrhea, and dehydration, we advise the mother to bring the patient to the emergency department. For follow-up, we had the mother scheduled for a well child check because the patient is 8 months old. We had it scheduled for 2 weeks for his 9-month well child check and to follow up with his endocrinologist as scheduled for further maintenance of his congenital adrenal hyperplasia. Thank you for listening to my case on teething syndrome.